Also, all hospitals should have a uniform, simple, standardized process of care and comprehensive team approach, which can improve the infant overall stability, safety, and good outcome. So what is the goal from this course? Should provide a concise guidelines of pre-transportation and post-transportation stabilization activities, which will include in a format optimizing retention and recall, targeting majority of neonatal problems encountered. So improve patient safety by what? Standardized process and approach to care, encourage teamwork, identify where medical errors which can do and occur, reduce and eliminate preventable adverse event by offering guidance for safe care of vulnerability patient. So the pre-transport stabilization very important. If possible, and it is the most safe, transport a mother before delivery to a center providing specialized infant and maternity care. So the in utero transport is the safest method for the infant and fetus. So under all circumstances, what we should do: anticipate, recognize, act, and reassess what we did. So the neonatal transport team goal to transport a well-stabilized infant, reduce possibility of adverse event which may lead to poor outcome. So the goal best achieved when stabilization include all healthcare team members, coordinated, timely, organized, and consistent. So what is the step? Meaning sugar and safe care, temperature care, airway care, blood pressure monitoring, lab work, and emotional and family support. So you need to remember what to do may be difficult when faced with a little opportunity to use skills or information. So mnemonic can enhance learning, recall, organization of information. So you need to remember the basic ABC: airway, breathing, and circulation. So this comes first, ABC. All the time, you have to remember that. Airway, breathing, circulation. That's the priority. Okay. So this we need to remember it by heart. So what we should understand in these modules, it's a 6 modules. One of it is sugar and safe care. And we should look after the issue of patient safety and error reduction, infant at risk for hypoglycemia, morbidity and mortality for the late preterm, screening for gestational diabetes, aerobic and anaerobic metabolism, and initiate the IV therapy, monitoring for signs and treatment of hypoglycemia, indication and safe use of umbilical line. Okay. So patient safety deserve and expect a safe quality of care. Healthcare delivery is extremely complex. Error can occur, but may result in injury. So difficult to quantify full extent of the problems of healthcare. So the preventable adverse event, injury caused by medical or nursing management rather than the underlying disease or condition. So what is the definition of patient safety? Is freedom from accidental injury. Okay? So if the infant, for the sugar, if the infant is sick, so we have to avoid enteral feeding, keep him in BO. Why? Because there is risk of aspiration, risk of bowel obstruction, risk of impaired blood going to the bowel. So the risk for aspiration might cause what? Respiratory distress, might get